Mydriasis associated with ischemic cerebrovascular infarct affecting the ipsilateral cerebellar interposital nucleus in 2 dogs. Introduction. The article presents 2 clinical cases of dogs exhibiting anisocoria with mydriasis, linked to ischemic cerebrovascular infarcts that affected the ipsilateral cerebellar interposital nucleus. Anisocoria, characterized by unequal pupil sizes, can arise from a variety of causes including ophthalmological disorders, neurological lesions, or pharmacological agents. However, the involvement of the cerebellum in regulating pupil size is relatively rare and has not been fully described in naturally occurring cases. The goal of this article is to examine how these cerebellar infarcts might be linked to pupil changes and to present diagnostic findings, magnetic resonance imaging, MRI results, and outcomes of the 2 cases. This is important because while cerebellar ischemic infarcts are increasingly recognized in veterinary neurology, their association with anisocoria and mydriasis has not been thoroughly explored. Case descriptions. Case 1. The first case involves a 10-month-old male neutered crossbreed dog that presented with acute onset of ataxia, preceded by vomiting. Upon neurological examination, the dog exhibited severe vestibulocerebellar ataxia, anisocoria with a mydriatic left pupil, incomplete pupillary light reflex, PLR, and spontaneous conjugate rotatory nystagmus with a fast phase to the left. Postural reactions were delayed on the left side, and a right-sided head tilt was observed. These clinical signs led to localization of the lesion to the left cerebellum, consistent with a paradoxical vestibular syndrome. Routine blood work, including complete blood count (CBC) and serum biochemistry, revealed mild hypernatremia, elevated creatine kinase CK levels, and slightly increased C-reactive protein CRP but no significant systemic abnormalities. The ophthalmic exam confirmed the anisocoria, with incomplete PLR on the left side, but was otherwise unremarkable. The dog underwent an MRI of the brain using a 1.5 Tesla T unit. The imaging revealed a sharply demarcated, wedge-shaped lesion in the left cerebellar hemisphere, hyperintense on T2 weighted and flare sequences, and hypointense on T1 weighted sequences. Restricted diffusion and diffusion weighted imaging DWI further suggested an acute ischemic infarct in the region of the left interposital nucleus. Following a course of supportive care, including mirapatent, assisted feeding, and physical therapy, the dog improved over a 4-day hospital stay. 2 weeks later, a follow-up exam revealed only mild residual cerebellar ataxia and right head tilt, with full resolution of anisocoria and marked improvement in overall neurological function. At a 6-month follow-up, the dog was reported to be neurologically normal. Case 2. The second case involved an 8-year-old female spayed greyhound that presented with acute onset of non-ambulatory tetraparesis, accompanied by opisthotonous and left-sided weakness. Like the first case, neurological examination revealed anisocoria with a mydriatic left pupil, right-sided positional ventral strabismus, and delayed postural reactions on the left side. The menace response was absent in the left eye, and there was a right-sided head tilt. These signs localized the lesion to the left cerebellum, indicating a paradoxical vestibular syndrome. Routine diagnostics showed mildly elevated creatinine and creatine kinase levels, with an increased urine protein. Creatinine ratio suggestive of protein-losing nephropathy (PLN) is a possible underlying cause. The MRI identified a sharply demarcated lesion in the left cerebellar hemisphere involving the interposital nucleus, consistent with an acute infarct. Additional chronic infarcts were detected in the right cerebellum and left caudal colliculus, suggesting prior vascular events. The dog received similar supportive care and was discharged 7 days later, ambulatory with mild residual cerebellar ataxia and right head tilt. At a 2-week recheck, the anisocoria had resolved, and the dog continued to improve. Unfortunately, 3 years later, the dog was euthanized due to suspected humeral osteosarcoma. Discussion. The 2 cases described here provide insight into a rarely discussed association between cerebellar ischemic infarcts and mydriasis in dogs. The primary lesion in both cases involved the left cerebellar hemisphere, specifically affecting the interposital nucleus, part of the deep cerebellar nuclei. These nuclei have been experimentally shown to play a role in the regulation of pupil size, although the exact mechanisms remain unclear. Physiology of anisocoria. Anisocoria can result from dysfunction in the parasympathetic or sympathetic pathways that control pupil size. The parasympathetic pathway involves the oculomotor nerve, cranial nerve 3, which innervates the sphincter pupillae muscle, leading to pupil constriction in response to light. Disruption of this pathway, as seen in oculomotor neuropathy, typically results in mydriasis and reduced PLR. The sympathetic pathway, on the other hand, controls the dilator pupillae muscle, causing pupil dilation. Damage to the sympathetic innervation, as in Horner syndrome, usually results in meiosis constriction and associated signs like third eyelid protrusion and ptosis. Experimental studies in cats have demonstrated that ablation of the interposital nucleus causes ipsilateral mydriasis, along with an incomplete PLR and widening of the palpebral fissure. This is in line with the clinical findings in the 2 dogs presented in this study, suggesting a similar role for the interposital nucleus in modulating parasympathetic control over the pupil. However, the exact pathways linking the cerebellum and pupil control remain speculative, as direct connections between the cerebellum and parasympathetic centers have not been conclusively identified. Cerebellar control of pupil size. Experimental ablation of the fastigial nucleus, another cerebellar deep nucleus, has also been shown to cause pupillary changes, including contralateral mydriasis and third eyelid protrusion. In this study, however, Lesions were localized to the interposital nucleus, rather than the fastigial nucleus. Both dogs showed ipsilateral mydriasis, which may be indicative of the involvement of the interposital nucleus specifically in controlling ipsilateral parasympathetic pathways. Additionally, in previous reports, ischemic strokes affecting the rostral cerebellar artery have been documented to cause cerebellar dysfunction and occasionally anisocoria, but detailed descriptions of the anisocoria and its underlying pathophysiology were lacking. MRI and diagnostic imaging. MRI findings in both cases were consistent with territorial ischemic infarcts, affecting the territory of the rostral cerebellar artery, with involvement of the interposital nucleus. These lesions were sharply demarcated, with restricted diffusion on DWI sequences, indicative of acute infarction. In one of the cases, additional chronic lesions were noted, reflecting prior cerebrovascular events. Prognosis and outcome. Both dogs exhibited marked improvement with supportive care, with resolution of anisocoria within 2 weeks and full recovery of motor function within 6 months. This highlights the generally favorable prognosis of cerebellar infarcts, provided that the underlying cause, such as PLN in the greyhound, is addressed. Conclusion. The findings from these 2 cases suggest that cerebellar ischemic infarcts can cause reversible ipsilateral mydriasis due to involvement of the interposital nucleus. While the exact mechanisms remain uncertain, this study provides further evidence of the cerebellum's role in controlling pupil size and highlights the importance of MRI in diagnosing ischemic cerebrovascular events in dogs presenting with anisocoria.